All right. Think I'm live. All right. Yep. So this is Hat from Therapy and Wellness, and as we discussed last week, back pain. So this week we're gonna discuss about the shoulder pain. Every Friday, 6 p.m., we'll discuss different topics. We'll also try to put on the website the next topic. I'm thinking of doing monthly topic decide already, so people are aware of it. And any suggestion, as we discussed last time, you can always tell me, and we'll try to incorporate that. Okay, so we get lots of patients with the shoulder pain, so that's why I thought let me just go over some basic things about the shoulder pain. All right, I'm just gonna wait 1 or 2 more minutes. Again, this is Hat. I'm a doctor of physical therapy at Cure Therapy and Wellness. We are located in Carrollton, 4541 North Josie Lane, Suite 130. And okay. All right, so let's start some discussion. So many times I get question about the shoulder pain and I hear many times patients whenever they come with the shoulder pain, the basic thing is, okay, I got shoulder pain, I got rotator cuff injury, okay, or frozen shoulder. Those are the two most common terms that I hear. People don't know anything more than that. Okay, so whenever they have a pain, either it's a rotator cuff or it's a frozen shoulder, not necessarily. Okay, there are more to it than just a simple pain, or rotator cuff or frozen shoulder. So we're gonna kind of discuss a little bit about the anatomy, about the shoulder. Then we'll discuss about the a risk factor, what can cause more problem, some common causes of the shoulder pain. I'm gonna talk about some of the the common posture that can affect your shoulder pain. So let's talk about the shoulder pain anatomy. So the anatomy is the rotator cuff is 4 muscle. Okay, so it comes from the scapula. So there are supraspinatus, which is come on the top of the scapula, then the infraspinatus, then the teres minor, and then there is a one called subscapularis, which is right in front of the scapula. But that all comes right around around the shoulder, around here. So that goes around the shoulder. That's the reason it's called rotator cuff. Okay. Now let's talk about. Okay, Mahek says hi. Yep. Hi, Mahek. Okay. All right. Okay. One question. Whoever gives the right answer, I'm not gonna tell you right now. I'll tell you at the end. Whoever gives the right answer will get a free 3D scanner. Okay. All right, in the shoulder complex, in the whole shoulder complex, how many joints are there? Okay, so whoever gets the right answer, they get the 3D scanner. So 3D scanner, basically, just to give you an idea what is 3D scanner is, we have a machine, Yep, we have a machine that scans your body. It gives you detail about your lean mass, your muscle mass, your posture, weight bearing status, your basal metabolic rate. Okay, so it scans you in 30 seconds, but it gives you create the whole 3D avatar. Normally it's we charge $25 for that, but we're gonna give you one free for the correct answer. So again, what are the joints in the shoulder complex? How many joints in the shoulder complex? Okay, you don't need to tell me the name, just how many. Okay, don't Google it. Okay, all right. So let's talk about the joint portion. I'll come at the last. All right, shoulder parts. Okay, my hex says 4. All right, we'll see. I'll tell you at the end. Is it right or not? Okay. All right. So the part of the shoulder. Okay, so there's lots different part of the shoulder. So the tip that you feel right on the top, it's a combination. This right here is the clavicle, which goes this way, and it attaches with the acromial process, which is a part of the scapula. Okay, so that two things combine, and that becomes the acromioclavicular joint. Okay, so That right tip that you feel on the top of the shoulder, that's actually your AC joint. It's an acromioclavicular joint, okay? All right, okay, then we're gonna talk about the glenoid. So the glenoid is the fossa where your shoulder attaches. That first surface is called glenoid. It's more like a T on a golf ball. And literally, the shoulder is like a T on a golf ball. It doesn't have much support on the shoulder joint. It is mainly supported by the ligaments and muscles, like tendon, like your rotator cuff, okay? And that is the reason it's very crucial that you strengthen your shoulder muscles. You stretch before the workout, okay? Many gym injuries where, I'll give you one simple example. Let's say you're doing the bench press, 200 pound, 300 pound, okay? That's like working your pack, right? Now, imagine when you're doing that and by mistake your hand goes just a little bit up like this. Now, instead of going on the all the weight on the pectoralis, now when you turn, when you're rotating your shoulder, all the pressure goes on your rotator cuff muscle, which are small muscle. It's not a big muscle. It's not like a pectoralis muscle, right? So that weight really goes on the small muscle, and those small muscles that cannot handle it, and you get a tear or strain or something like that. Okay, and because of that, you get start getting a pain. Any overhead movement you cause pain, and anytime you're trying to do overhead presses or something, you start getting pain in your shoulder, because that's very common injury happens during the workout in the gym. Okay, so you got to be careful when you're working out with the heavy weights that your posture, your alignment is proper. And that's where the personal trainer comes in handy, because their job is to make sure that you're doing it right. Okay, so that would be a good option to have a personal trainer to just see your workout, or you can come here and you can go over your posture as well. Okay, let's talk about tendon, bursa, ligaments. You must have heard many times, I got tendonitis, tendinopathy, bursitis. What is that? Okay, all right, so the tendon, always the muscle convert in a tendon, and that tendon attaches to the bone. Okay, so that tendon always glide over the joint whenever you're trying to move it. Okay, that's the tendon. Now, whenever you get the impingement, okay, whenever you got irritation on your tendon, that's called inflamed tendon. That's called tendonitis. In the beginning stage, it's called tendonitis. Then you ignore it. Okay, I see Dana said 4. Okay, all right, I'll tell the answer in the last and we'll see. Okay, all right, so, and yes, I was talking about tendon. So yeah, tendonitis is the inflammation acute stage where your tendon got inflamed. You don't take care of that. Okay, you live with that. You think, it's just a little pain, it will go away. In some time, it becomes tendinopathy. Means that becomes scar tissue build up and it start getting a little bit rigid, and that is the reason it's called tendinopathy. That's a little bit advanced stage. Okay, bursa. Bursa is a fluid sac which act as a cushion for the tendon. So different part of the body, like mainly the joint, we have different bursa which act as a cushion to your tendon. So whenever you move your joint, your tendon kind of glides over it, and that bursa gives a little cushion. But if that bursa get inflamed, okay, that bursa got it's not much cushion left, the tendon will get lots of friction. And whenever you get lots of friction, that becomes tendonitis. Okay, so that's the reason it's very important that you treat the bursitis or tendonitis or tendinopathy. Okay, ligaments are also a support of the joint. The ligament always attaches to the bone, mainly in the joint, it's one surface to the other surface of the bone. The purpose of the ligament is just to stabilize the joint. Okay, all right, the risk factor. What are the risk factor for the shoulder pain? Occupation, that's the most common one, where if someone has to do repeated lifting or overhead activity, like a painter. Okay, so they do the painting, so overhead, like repetition and overhead movement, that can cause the shoulder pain. Okay, sedentary lifestyle, because it does affect whenever you're not moving your shoulder properly, more often, and all of a sudden you're trying to do something and then you hurt your shoulder. Okay, sleeping habits, or your habit. I've seen many times people sleep like this. Okay, just look at the shoulder position at that time. Okay, so that's very, very, very bad. Like, if you sleep that way, you either wanted to make sure don't sleep like this ever. Okay, because whenever you're overhead like this and you're sleeping on it, you're stretching your whole shoulder joint. Okay, and that can cause the impingement. So do not sleep on the side like that. If you're a side sleeper, the best position, you go a little bit inclined, keep the bottom shoulder a little bit forward, and the top shoulder, keep the pillow in front of you, so you're resting on that. Don't cross it like that. Okay. Smoking also affect the people who smoke. They have a high effect on the shoulder joint, because when you smoke, the circulation get compromised in the joint. Okay, and because of that, there is high chances you may get a poor circulation in the shoulder. Okay. Diabetes, that's very common. It's very common for people with the diabetes to get the frozen shoulder or a shoulder problem. Okay. All right. Okay. Now we're gonna talk about the 5 most common causes. What are the common causes of shoulder pain? Okay, the one is arthritis. Arthritis is basically lots of wear and tear in your shoulder, in your capsule. You get lots of arthritis, the joint surface, cartilage get lots of wear and tear, and it just happened over the time. And Tim is online. Okay, hello. Okay. All right. Okay, so the arthritis is like, the cartilage get lots of wear and tear, and that eventually become painful. As long as it's not hurting, you're okay. But if it start bothering you on a daily basis, then definitely you wanted to do something about it. Okay. Rotator cuff injury or impingement. Okay. The rotator cuff injury or impingement, as I mentioned about the tendonitis or bursitis, the wrong technique can cause those kind of problem. Let me show you one of the things that can easily cause impingement. Okay. Now, okay, so let's see. If someone is like this, okay, let me pull a little bit. Okay. All right. So if you see my shoulder, okay, my thumbs, my fingers is like this, okay? If someone with the forward shoulder, okay, it will be like this, okay? Now, just see, if it's a straight shoulder, I can raise it up. No problem, okay? Let's say, but if my shoulder is like this, like forward head posture, right? So it's like this now, okay? And then if I try to reach it, okay, I have a limitation, and that's where you get the impingement. Okay, so that's where you get the impingement. So that's the reason the posture is very important, that you do the right posture. Okay, the second one is the labrum tear. The labrum is that glenoid that I was talking about, the T. Okay, so that's a rounding is like a labrum. Sometimes you can get a tear in that one too. It's very crucial that you see the doctor at that time. When you get a labrum tear, you wanted to make sure you either see us or you can see the doctor, and we can find out how bad is the problem is. Okay. Now the fourth one is the instability. Okay, many times you must have seen, like, the shoulders, one is like a dropped or like too much forward, or it's subluxed or something like that, or if the tip of the shoulder is way out of portion compared to the other side, that is the instability. That happens because of the direct blows, sports injury, those kind of things. Okay, I think we have some connection issue. It seems like it's a little choppy today. Okay. Okay. How do I win 3D body scan? Yes, so all you need to do is answer the question that how many joints are in a shoulder complex. You give the answer and you win a 3D scan. So far, I know Mahak gave the answer 4. Dana gave the answer 4. Okay, and we'll see. At the end, I'll tell you what it is and how many are there. Okay. All right. Okay. Then frozen shoulder, most common one, like most commonly heard, frozen shoulder. So the frozen shoulder is basically we have a capsule surrounding the joint. Okay. So in that surrounding the joint, that becomes tight, and that happens because of the inactivity. That is the reason it's very crucial, even after the surgery, even after the injury, it's very crucial that we move your shoulder. Okay, there are different movements that we can do to help it. Okay, but to maintain that range is very, very common. There are 4 stages of the frozen shoulder. Okay, so the first stage is called pre-freezing. So first to 3, it lasts for about 3 months. So in that stage, you basically start getting limitation in the range, okay, and you got a little bit pain here and there. Then the freezing stage, which is like, from 3 to 9 months, it starts creating more limitation. You cannot bring your hands back, you cannot raise it over the hand or side, okay. And then there is a frozen shoulder. That's the third stage, which lasts from 9 to 14 months. How many joints are in shoulder complex? That's the question. Okay. All right. Okay. Now, frozen one is where you get lots of limitation. You can barely move your shoulder. You can barely go back. And that's the last stage is a thawing stage where you can start getting recovery actually. And that happens from anywhere from 12 to 15 months. But that doesn't mean that if you don't do anything about it, it will get better. What happened during those stages, during the 15 month of stages, your shoulders start getting weaker and weaker, and eventually what happened that it gets lots of injury with the rotator cuff, your ligaments get lots of affected. Okay, so that is the reason that you need to make sure whenever you start getting pain or frozen shoulder, you need to do the exercise to make sure it doesn't go to the next level. Okay. Okay, now many times I see patient say my problem is here. Why do I have a pain in the back, upper back? Because your scapula, your shoulder blade is a part of your shoulder complex. Okay, so whenever you move your shoulder, the ratio of the shoulder movement and your scapula is 1/2. Okay, so it starts going up, and after 30 degrees of this is called abduction. Going outward, it's called abduction. Okay, so as soon as after 30 degrees, your scapula start rotating by 1/2 ratio. Okay, so right here, it start moving your scapula. So if you have a limitation in your scapula movement, okay, you will have a problem with the shoulder movement overhead. Okay, that's called scapulohumeral rhythm. Okay. So it's very important that you have those both sides. That's the reason sometimes the therapist will work on your scapula to release the tension on those muscles so your scapula can easily glide. Okay? All right, let's talk about the posture. Most common problem with the posture. So I'll talk about 5 posture that affects your shoulder. Okay? The first one is the cradling. Okay, cradling of the phone. So my phone is not around here. Okay, so basically what you do is, let's say this is the phone. Okay, many times people go like this. Okay, so there's a cradling of the phone. You see my position of the shoulder. My shoulder is elevated like that. If it becomes a habit, that's the problem. Okay. So that's the reason it's very important that you don't do that. Get the headphone, get the wireless. There are so many things available out there. Okay, so you don't want to do that. Rounded shoulder. Okay, so as I mentioned earlier, rounded shoulder is basically going like this. Okay, if you notice, that my knuckles facing forward, that means I have rounded shoulder. Okay, you can see in the sideline like that. It should be more like this. But it goes like this, then it rotates in. Okay, so that's rounded shoulder. Okay, and that happens whenever that happens. That basically your pectoralis muscle is tightening up and it goes in. So the best thing to cure that posture is to stretch your pectoralis muscle. When you do the stretching for the pectoralis muscle, you can do on the door. Just hold it on the side and stretch it. Okay, that really helps your posture with the rounded shoulder or hump back forward. Those really helps. Okay. Hunchback or text neck. Okay, this is very, very common. How many times you do like this? Okay, so if you notice, my shoulder is going forward as well. Okay, so that does affect your shoulder as well. Once you got that posture, to correct it, if you have not invested in the foam roller, I highly suggest to get one foam roller. Okay, because you can do so many things with the foam roller. You can do the myofascial, like you can use on different muscles of the body. You can use your upper back. It can improve, like, you know, your stretching. It improves your thoracic spine. It improves your like all this, like, you know, rounded shoulder. It can really help you. Okay, holding purse. Okay, many times I got that. Okay, so let's see. This is empty. Right now it's empty. There is nothing in it. Okay? So if you do like this on the side, right now it's empty. My shoulder is level. This is 5 pounds. Okay? So if I put the 5 pound in it, okay, if you compare, my shoulder is dropped a little bit. Believe me, 5 pound is very easy. The girls, the women, they keep the things in their purse. Definitely it will be 5 pounds. You can weigh your purse, but you can imagine, like, you know, that my shoulder, just by adding a 5 pound, kind of would drop a little bit. That does affect. So how do you correct it? How do you fix it? Either go this way or reduce the weight. Okay? Okay, the other thing is bag. Okay? So when you hold the bag, you won't be able to see the whole bag. But when you hold it, so right now it's lightweight, so I'm not dropping. But if it's a heavy, okay, it will drop it like this. Okay, so you're walking like this. So instead of that, bend your elbow. When you bend your elbow a little bit, your shoulder doesn't affect. Now you're using your biceps, triceps, all those muscles to lift your back. Okay, so make sure you do that. And the most common one right now is a forward head. Forward head, because right now it's all about Zoom. Okay, right now it's all about Zoom meetings, computer work, a lot of things like that. Okay, so in that way, you're sitting on the computer. If your ergonomics is not right, your shoulder, and yes, you can email me or reach out to our office, and we can send you a video on office posture, like how your desk should be, what is the level of the computer, what is the height of the chair. So we're gonna send you all the information if you need it. Okay. Okay, so most of the time, like, you're going like this. Okay, so your forward head posture like this. So then you got the rounded shoulder, the whole upper back becomes rounded. So your posture becomes like this. Okay? To improve it, as I say, you can take a foam roller, put it on the upper back, and you can stretch your back. Okay? I can send you some best 5 exercise to improve your posture. So along with that office ergonomics, I will send you that 5 best stretches or exercise to improve your posture. Okay, all right, so we're gonna conclude with this one today. Okay, so I hope I answered all your questions, and we'll come up with the topic next Friday again at 6 o'clock. And any question, anything, you can email us, call us, and we will be able to reach out to you and let you know. Now, one more thing. How many joints in the shoulder complex? And it's Dana and Mahak answered 4, and that is correct. That is the correct answer. So you both can have a 1 free 3D scanner session. Just reach out to us, and or you can go online and book it yourself, but you can call us and we can help you with that too. And our hours are from 9 to 6. If you're coming before or after hours, you can always reach out to us and we can see if we can accommodate that time. And now, what are those 4 joints? Okay, so one is sternoclavicular. So this is a sternum, this is a clavicular, so it attaches right here. That's a sternoclavicular joint. Okay. Okay, all right, so that's the sternoclavicular joint. Okay, then the glenohumeral joint, that's our main shoulder joint. It's called glenohumeral joint. Okay, then there is the acromioclavicular joint. So acromial process from the scapula and your clavicle, that's a acromioclavicular joint. And then there is a scapulothoracic joint. Okay, your scapula attaches with your thoracic spine, with your the rib and all the thoracic. That's called the scapulothoracic joint. Okay. All right, so Dana and Mahek can book the appointment, and you can come and get your 3D scan. Okay. All right. Have any question, you can question me here, or you can reach out to us. But I will see you all next week at 6 p.m. And if you have any suggestion or any topic that you wanted to discuss, feel free to reach out to us. Okay. And I'm sorry we had some technical error today. It seems like our network was slow. It's a little choppy video today. I will see if we can fix it next time. And I will see you all next week. And our phone number is 469-212-8888. And our website is surecurewellness.com. All right, I'll see you all next week. Thank you.